Now that we know the anatomy and physiology of the spinal cord, let's take a look at the nerves that attach to the spinal cord. So these nerves are in 31 pairs all the way down the spinal cord. In the next chapter, we're going to talk about the peripheral nerves that attach to the brain. Those are known as cranial nerves. Obviously, if you're attached to the spinal cord, you're known as a spinal nerve. So nerves all have one thing in common in that they contain a bundle of hundreds or thousands of neuron axons, each of which are located along a defined path. So we know where all our peripheral nerves are located. And they have a defined path because they serve a specific region of the body. All right. And again, these nerves could have sensory neurons in them, or they could have motor neurons in them, or they could have both in them. It just depends on the specific nerve. Now, in this drawing, it shows kind of the layout of a nerve. There's quite a bit of connective tissue in a nerve. There's adipose tissue in the nerve. There's blood vessels in the nerve. And then there's kind of a certain pattern in which the neurons are bundled. So the entire nerve is surrounded by a layer of connective tissue called the epineurium. Then there are bundles of neurons wrapped in connective tissue called the perineurium. And then each individual neuron has its own layer of connective tissue called the endoneurium. You'll notice that this axon must be myelinated because it has a Schwann cell surrounding this area producing that myelin. This diagram does not tell us what kind of neurons these are. They could be sensory neurons, they could be motor neurons. This doesn't really tell us. When we get to the cranial nerves in the next chapter, each of the cranial nerves we know whether they are strictly sensory. So for example, your optic nerve that comes out of the eye is strictly sensory. It's sending the signals from the retina into the brain. Other cranial nerves are strictly motor. So all they're going to be doing is sending signals away from the brain and not any signals to the brain. And then some of the cranial nerves are mixed, meaning they contain both sensory and motor neurons. When it comes to the spinal nerves, they're all mixed. Okay, so every spinal nerve has a combination of sensory neurons and motor neurons. So the sensory neurons might be sending in, maybe touch or pain senses, whereas the motor neurons might be extending out to, say, a skeletal muscle. All right, but those nerves are going to have both sensory and motor. How do they reach the spinal cord? They go in between the vertebrae through the intervertebral foramina. So as you go down a spinal cord, there's 31 pairs of spinal nerves attached. The first 8 pairs are cervicals, so we can refer to them as C1 to C8 spinal nerves. Then there's 12 thoracic spinal nerves, 5 lumbar spinal nerves, 5 pairs of sacral spinal nerves, and 1 pair of coccygeal nerves. So 31 pairs total. Now, one thing you want to make a point of is there's 8 pairs of cervical nerves. A lot of times we think it's the same number of nerves as there are vertebrae, and that's not true. Remember, there are 7 cervical vertebrae, but there's 8 pairs of cervical nerves. Okay, so this is a picture showing kind of how those nerves are attached to each side, right? So we kind of go down and see, the 8 pairs of cervicals, the 12 pairs of thoracics, the 5 pairs of lumbars, the 5 pairs of coccygeals, and 5 pairs of sacrals, and 1 pair of coccygeals. Now, the tricky part is that these nerves interconnect with one another. So they don't just extend straight out and go to their location. A lot of the neurons will enter different nerves. So they interconnect with one another and form what's called a plexus. So a plexus is basically a nerve network where some of the neurons will be kind of mixed and matched in between different spinal nerves. So you can't maintain this no kind of way to name a nerve because, for example, let's say this nerve right here might have some neurons that came from C1, it might have some neurons that came from C2, it might have some neurons that came from C3. All right, same is true if we look down here. This nerve that extends out here, notice some of the neurons might have came out here, some other of the neurons might have came out here, so they come out different levels. All right, so we're going to go through each of these nerve networks. All right, cervical plexus, brachial plexus, lumbar plexus, and sacral plexus, and learn the nerves that extend out from those nerve networks. All right, so you'll notice that on this side, it shows what spinal nerves form what plexus. So the cervical plexus is where C1 to C4 all interconnect with one another. The brachial plexus is where C5, C6, C7, C8, and T1 all interconnect. There's no plexus along the thoracic region, so these nerves just come straight out, and they don't kind of mix and match neurons. And then there's a lumbar plexus formed by L1 to L4, sacral plexus, which is formed by L4 to S4. All right? So we basically start from the top and work our way down. And each plexus may or may not have a lot of nerves that we're going to learn. Okay, so for example, the cervical plexus, we're only going to learn one nerve. There's a lot of other nerves. So if you were, maybe going into medical school and taking an anatomy course in med school, you might learn more. But for our level, off of this cervical plexus, we're going to learn one nerve, and it's known as the phrenic nerve. So these drawings here show which spinal nerves form the plexus. All right, so we see it's C1, C2, C3, and C4. So some of these neurons are going to go into different nerves. All right, now if we take a really close look at this nerve right here, it has neurons that actually come from C3, 4, and 5. And that's called the phrenic nerve. There's a little phrase that we say quite often in that C3, 4, and 5 keep the diaphragm alive. So the phrenic nerve is a combination of neurons from C3, C4, and C5. And that nerve goes all the way down through your chest and gets to the diaphragm. So it's going to be sensory. So if the diaphragm gets any kind of irritation, or maybe if the diaphragm gets any kind of trauma, there will be sensory neurons going through that phrenic nerve. And then it has motor neurons. And the motor neurons are what's going to stimulate the diaphragm when you're breathing. All right, so this is a really important nerve if you think about it, because it controls your diaphragm, and you can't breathe without being able to contract and relax your diaphragm. All right, so cervical plexus formed by C1 to C4, most important nerve being the phrenic nerve. All right, it's sensory and motor for the diaphragm. Okay, now we move to the brachial plexus. And the brachial plexus suggests that, it's going to have nerves that go to the arm. Again, these are spinal nerves, so they're mixed. They're going to have sensory and motor neurons in them. The brachial plexus is formed by C5, 6, 7, 8, and T1. And it has 5 really important nerves: axillary nerve, radial nerve, musculocutaneous nerve, median nerve, and ulnar nerve. All right, now you already noticed that a couple of these are named after bones. All right, one of them's named after the armpit, and then one's called the musculocutaneous because it goes to muscle and skin, but actually all these do. And then median means in the middle because it's in the middle of the radial and ulnar. So they're named fairly logically, using some of our anatomical terminology. So just like the phrenic, where there's sensory and motor, these are also sensory and motor. So we want to know, okay, well, what's the motor component? And that's typically going to be what muscles does the nerve control? And then what's the sensory? And for these, most of that sensory has to do with regions of the skin. All right, so let's start with axillary. The axillary nerve controls your deltoid muscle and your teres minor muscles. All right, so that's the motor part. The sensory part is your shoulder joint, as well as skin basically around that shoulder area. All right, so that's where it has sensory neurons. Musculocutaneous. So that one is going to control your elbow flexors. And recall your elbow flexors are your biceps brachii and brachialis. What's its sensory? Skin of the lateral forearm. All right, so that's the sensory component. The radial nerve basically goes back down the back of your arm. So in the back of your arm, you're going to have muscles in the posterior arm and forearm. Now, most of those muscles, if you recall, are extensor muscles. So in this case, it would be, say, your triceps brachii, right? That's a elbow extensor. And then muscles in the back of your forearm that might extend your wrist. So your extensor carpi muscles. The sensory component is posterolateral surface of most of your upper limb. And we're going to look at some better pictures showing these areas. Median nerve goes to flexors of the anterior forearm, so like your wrist flexors. Some of the intrinsic muscles of the lateral palm and fingers. So what we're looking at there is basically your thumb side of your hand. All right. Intrinsic muscles are muscles in your hands. All right. And then it's the skin of the lateral 2/3 of the hand. So if you look at that hand, lateral 2/3 would be your thumb, your index finger, and your middle finger. Okay, then you have the ulnar nerve. It goes to flexors of the anterior forearm as well, and most of your hand muscles. And then the skin of the medial third of your hand. So medial third of your hand, if you're looking at your hand, is your pinky finger and your ring finger. All right, so we're going to kind of go through each of these individually. These are the images from your textbook. I like these because it gives you a visual of the skin region. All right, so we're going to kind of go quickly here because we already did it. But again, these are very good to give yourself a visual. All right, so axillary nerve, okay, it controls your teres minor and your deltoid. The skin segment that it gets sensory from is right here. So it's basically your shoulder area. It also innervates the joint. So that's important if you're getting any kind of shoulder surgery. There's anesthesia in which they can block this nerve. So they can inject the anesthesia so when they're doing the surgery, none of those sensory signals can get through that axillary nerve coming from your shoulder joint. Okay, next picture is the musculocutaneous. So remember the motor portion is biceps and brachialis. So if you had any nerve damage, you want to think about what the result would be. So if you had nerve damage, let's go back to the axillary nerve. The biggest movement that you would not be allowed to do is abduction. All right, you'd have a really difficult time abducting that arm. All right, because of that deltoid muscle. You would still be able to flex your arm and extend your arm because you got a lot of other muscles that do that. You have your pectoralis major, you got your latissimus dorsi, but you'd have a very difficult time abducting the arm. If you have a nerve injury of the musculocutaneous, you'd have a really hard time flexing your elbow, right? Because it controls your elbow flexors. And then this is the region of the skin that it gets its sensory neurons from. All right, so this is the lateral forearm here. All right, next one is the radial nerve. And I always try to remind students that the radial nerve goes posterior. This is a posterior view of the arm. And what's in the back of your arm? Well, you've got a lot of extensors. So you've got your triceps brachii muscles. You also have a lot of your extensors in the back of your forearm. All right. And if you injured this nerve, you'd have a hard time extending your elbow. You'd have a hard time extending your wrist. All right. And then notice this is a posterior view. So it innervates most of the skin down the back of your arm. All right. Most of the back of the brachium, and then a little, quite a bit of the back of your forearm and the back of your hand. Median nerve is named because it runs down the middle of the forearm. It basically runs down in between the radial nerve and the ulnar nerve. This one is going to go through a little tunnel in the wrist called the carpal tunnel. And if you've ever heard of carpal tunnel syndrome, that is a neuropathy of the median nerve. So pressure forms on that median nerve in the wrist. Typically, it's due to using your hands, kind of improperly positioning your hands when you're typing a lot or using your hands quite a bit. And everyone who's had carpal tunnel syndrome knows that it starts with the thumb side. You get a little bit of tingling in your thumb, your index finger, right, your middle finger, and that's because that's where that median nerve gets its sensory signals from. All right, so this median nerve innervates muscles of the lateral palm and fingers, and then gets its sensory signals from this lateral 2/3 of the hand. Finally, ulnar nerve, as the name suggests, kind of runs along the ulna. Sometimes we might pinch that ulnar nerve up against the medial epicondyle, so we call that our funny bone. And if you've ever hit your quote-unquote funny bone, you kind of know where the ulnar nerve goes. It goes down and innervates your pinky and basically like half of that ring finger. But this one innervates most intrinsic hand muscles. So most of your muscles in your hands are controlled by the ulnar nerve. Okay, so those are all the nerves of the brachial plexus. This is a good picture because it shows them all on one picture. This happens to be my favorite picture of the brachial plexus, showing the 5 nerves. It's all kind of color coordinated for you, and you can kind of see where these nerves are. And when you read the descriptions of each of these 5, for example, what muscle and what skin segment, it makes sense. So for example, you see the axillary nerve going to the shoulder. So it makes sense that it controls your deltoid. You see the musculocutaneous in front of the humerus. Makes sense that it innervates your biceps and your brachialis. The radial nerve, you can see it's kind of behind the humerus. So it should make sense that it innervates your triceps. Median nerve goes right down the middle and then innervates your thumb side. And then the ulnar nerve goes along the ulna and innervates your pinky side. So I like this picture as far as the anatomy of these nerves of the brachial plexus. Next video, we're going to move on. No, we're not. We're going to cover some of the neuropathies you might see. So the thing with nerves is if you understand their function and then there's damage to them, it makes sense you would get a very, obvious kind of clinical sign. So, for example, this Herb Duchenne injury is C5 to C6, and it results in what's called Wader's tip. So, Wader's tip is where you have this classic kind of hand paralysis. Wrist drop is a radial nerve injury. Remember, the radial nerve causes extension, right? Extension of the wrist. So this wrist drop is when you can't extend that wrist because you can't stimulate those extensor carpi muscles. Median nerve palsy, so this would be like a very severe kind of carpal tunnel situation where you have the inability to oppose your thumb All right. We have here an ulnar nerve palsy. Remember, the ulnar nerve goes into the pinky and ring finger. So you might get this paralysis of those two fingers. And then there's also one, we're not going to learn this nerve, the thoracic nerve, that innervates your some of your scapular muscles. So you get this kind of winging of the scapula. But the ones that I like to show just as kind of examples is this wrist drop, because it makes sense because your radial nerve controls your wrist extensors, your median nerve palsy, and your ulnar nerve palsy. All right, next video we're going to move on to the lumbar plexus.